Hi, this is Scott Levy, Chief Medical Officer at Doylestown Hospital, with my mask in my pocket today. Things are really beginning to improve as we talked about over the last several weeks. Not only the Bucks County cases down more than 20% as a rolling average over the last 14 days, but we've seen a similar trend for Pennsylvania, for the United States as a whole. We're now at a 14-day average, almost 50,000 cases. And we've also seen significant trends down in major cities, Miami, Chicago, Philadelphia, New York. So all the evidence is good. That vaccine, people getting out more, it's all working. So everybody begin to normalize your life if you're vaccinated. I know the CDC recently came out with some guidance about what vaccinated people need to do and need not do, and it really raised some questions. But the guidance is actually pretty straightforward. And sometimes science is illogical and difficult to follow. This is one of the instances where it's pretty easy to follow. I'd suggest everybody looking at this guidance as walking in the street with a sprinkler watering somebody's lawn. If you could walk past the sidewalk and only get a couple of spritzes of water on you, you don't really have to worry about it. If you're going to stand in front of that sprinkler for 20 minutes and get soaked, that's not so good. It's the same thing with the virus. If you're going to be walking in the street and passing by somebody pretty quickly, it's like walking quickly through a sprinkler. There's not enough viral load as it dissipates in the atmosphere to really cause a problem. However, if you're going to be standing in one spot, specifically if there's people who are standing right next to you and constantly potentially exposing you to virus, and you would get very wet if you were in front of a sprinkler, you're more likely to get infected than not if with somebody like that in the street. So that's the time to wear a mask. If you're going to a concert or an event where you're going to be sitting in a chair outdoors with people very close proximity, that's a risk. However, if there's motion and you're not in one spot, the mask is really not necessary in public. If you're vaccinated, we all know the chance of getting infected is exceedingly low. We've seen several people with vaccinations still become infected and wind up in the hospital even. But that number is woefully small, and those folks are typically out of the hospital in 1 or 2 days, not 1 or 2 weeks. And they're doing very, very well. This vaccine is probably one of the most successful vaccines that's been created as far as effectiveness. But it's not 100%. Nothing is 100%. The small number of cases of people who are getting vaccinated and get sick, everybody talks about them because they're so uncommon and it's so unusual. The chance of getting COVID, being vaccinated, is less than 1 in 11,000. To give you a sense, overall, 1 in 11 people in the country has been exposed to COVID. So it's a significant drop. So please get vaccinated, wear your mask when appropriate indoors, and begin to enjoy the normalization of life, because we're certainly going to continue to see these trends improve. Be well, thank you.